One of the newer words we've heard a lot of during the pandemic is nowcasting. We're used to forecasting, of course, predicting the future, but talk of nowcasting makes us realise that to properly know what's happening right now may not be possible. And we have to estimate it using the sort of techniques we associate more with looking into the future. One example of nowcasting is estimating the infectiousness parameter R. It's not a value you can calculate simply, objectively from recent case numbers, because it depends hugely on the reporting delay between the moment of infection and the time when a case is confirmed. The problem is compounded by heterogeneity. If the prevalence of infection varies across the country, if perhaps the time lag effect varies across individuals, then the whole thing becomes more complex, more uncertain. So the number we are now casting is less an objective statement of reality today, more a somewhat uncertain modelling output. But this is not to disparage the work by saying it's modelling, therefore uncertain, therefore bad. I actually want to say the opposite. If even the numbers we think describe reality today can only be achieved at by modelling, that just shows how vital modelling is. And the use of a model does not make your view in some way less robust. Quite the opposite. Good use of good models makes us better informed. As one example, consider all the noise about the government's reliance on modelling back in March when making the lockdown decision. Many people decried the modelling, but I think this was a case not of one model too many, but of one model too few. What we also needed was a good model of the economic and health impact of the lockdown. Some actuaries have been working on this linkage between the economy and its influence on mortality and morbidity. This is the sort of work we need more of to try to estimate the longer term impacts of lockdown, to try to inform this type of decision making. Most of us are convinced that the lockdown saved lives, saved a lot of lives. But we can also be concerned about the lack of balance here because we never saw this trade-off debated properly. Perhaps we could have had a shorter lockdown. At the moment, it's unclear. These are the sort of questions that actuaries are well placed to answer, and models are essential tools to inform those answers. Thank you.